It is estimated that 1 in 70 women in the United States will develop ovarian cancer during the course of her life. Ovarian cancer is a malignancy that starts in the ovaries and may spread to other parts of the abdomen or pelvis. Nearly all women are susceptible to ovarian cancer. The incidence is higher in industrialized nations and less common in Japan and third world countries. Studies indicate that there appear to be 2 categories of women who are at a higher risk for developing ovarian cancer.
It is clear that ovarian cancer can run in some families. And the details of that have yet to be fully worked out, but clearly if a woman has 2 or more first or second degree relatives who have had ovarian cancer, she is indeed at relatively high risk. Another group is women who have been unable to conceive for whatever reason.
Dr. Eddie Reed of the National Cancer Institute is a leading clinical researcher in ovarian cancer.
Ovarian cancer is divided into 4 general stages. There are substages of each of these 4, but in general, stage 1 disease is limited to 1 ovary, either the right or the left ovary. Stage 2 disease involves both ovaries. Stage 3 disease is spread beyond the ovary to involve the abdomen and pelvis. And stage 4 disease is spread beyond the abdominopelvic cavity.
In general, ovarian cancer falls into 3 different histological groups. Epithelial cell cancer appears in the vast majority of women. Germ cell ovarian cancer is most often seen in younger women who are of childbearing age. Stromal cell cancer is usually associated with abnormal hormone production. One of the biggest problems with ovarian cancer is that it is very difficult to detect. Most women are asymptomatic until a tumor is large enough to be discovered during her gynecological.
There are non-specific problems that will develop, such as the abdomen becoming larger, clothes fitting more tightly around the waist, general abdominal discomfort. And it is relatively rare that individuals will experience frank pain or bleeding of some type.
There is one test currently in use that may detect ovarian cancer. It is known as the CA-125 test. It is a cancer marker that will appear in a specific blood test. However, the CA-125 test is not 100% effective.
The matter of when a woman should have a CA-125 test done is a fairly complicated matter because the CA-125 will be elevated during a normal pregnancy, and the CA-125 will be elevated during normal breastfeeding. A CA-125 can be elevated if a woman has endometriosis. So there are a number of benign situations where the CA-125 can be elevated. And so to simply use the CA-125 in and of itself as a screening tool, I think is probably not advisable, particularly in women of childbearing years.
Women diagnosed with ovarian cancer tend to be in their late 50s and early 60s. Depending on the type of cancer, this can be highly variable. There are cases on medical record of women in their late teens developing the disease, as well as women in their 70s and 80s.
Generally speaking, any type of ovarian cancer is very serious, and any type of ovarian cancer is potentially life-threatening.
Ovarian cancer treatment usually includes some combination of surgery and chemotherapy. physicians and oncologists weigh laboratory and examination information to determine the best plan of attack.
For every ovarian cancer patient, one should expect that surgery and chemotherapy is going to be a part of the treatment approach. Now, there are some sets of patients where you use surgery only, some sets of patients where you use chemotherapy only. But for the vast majority of patients, one should expect that surgery and chemotherapy will be administered as part of the initial treatment.
Laparotomy or abdominal surgery is used to eliminate all visible tumor. Then one or several drugs might be used to rid the body of remaining cancer cells.
In the initial treatment of ovarian cancer, the drugs that are most commonly used are cisplatin and Cytoxan, or carboplatin and Cytoxan. There are some individuals that might be at particular risk for side effects from those agents, and there is a long list of other drugs that can be considered. But those three agents, cisplatin, Cytoxan, carboplatin, as of this moment, constitute the mainstay of initial treatment for ovarian cancer. Recently, the FDA, the Food and Drug Administration, approved Taxol, which had been an experimental agent. The FDA approved Taxol for the treatment of patients who had received cisplatin and Cytoxan, but their disease had recurred.
Women react differently to chemotherapy. Side effects range from mouth soreness and hair loss to nerve damage. Extreme fatigue and lower blood counts leave patients feeling worn out. Because the drugs must kill cancer cells, they are very powerful and take their toll on normal cells as well.
When patients receive chemotherapy for ovarian cancer, it is not a picnic. It is a very draining experience. And one needs to be mentally prepared that potentially life-saving chemotherapy, which is necessary to kill tumor cells, also makes normal cells sick.
The statistics for survival are encouraging. Research advances have improved a woman's chance for living disease-free much longer than in previous years.
Patients who have stage 1 disease, that is limited to one ovary, who are appropriately treated, their chance of long-term disease-free survival, and by that I mean the tumor never coming back, is better than 90%. And in some subsets of those individuals, better than 95%. For individuals with stage 2 ovarian cancer, appropriately treated, the chance of long-term disease-free survival exceeds 70%, and in some subsets of patients exceeds 80%. In stage 3 disease, and stage 3 involves the abdominopelvic cavity, and that is the stage where about 2/3 of patients are diagnosed. Long-term disease-free survival is in the range of 15 to 20%. Now, with initial therapy, stage 3 patients who are treated appropriately, you can put the disease into remission in the vast majority of those individuals for some period of time. And that period of time may range from 1 to 2 years to as long as 8 or 10 years. But the chance of being in a situation where the disease will never come back, and these are people with stage 3 disease, we're talking about a 15 to 20% chance. Individuals who are diagnosed as having stage 4 disease, and this is widespread disease to the lungs, to other places in the body, the chance of long-term disease-free survival, even with the best treatment, is less than 5%.
Researchers at the National Institutes of Health and around the world are looking at ways to improve current treatment approaches that will improve long-term survival for women who suffer from this disease.
In our current approach, we're giving chemotherapy more intensively, and we are giving 2 treatments after the time that we have visibly eradicated all evidence of disease. Obviously, it's going to take 5 or more years to realize whether or not this approach is successful. But what we anticipate is that we're going to be able to improve that 15 to 20% number somewhat. We're hoping we can get it up much higher. We're hoping we can double that.
Bone marrow transplantation is another new area of research in treating ovarian cancer. It has had beneficial outcomes for other similar diseases, such as leukemia and some lymphomas. But the technology and applications are still very new, and at this point, the cost-benefit ratio is still very large. Scientists are also looking at radiation and laser therapy that might be used to treat the disease. And of course, the search for new and more effective chemotherapy agents continues.
The best thing a woman can do who is concerned about the possibility of developing ovarian cancer is to maintain regular checkups with her physician. The things that should be considered in terms of whether or not a particular symptom or a particular problem should be pursued, and whether or not additional tests should be done, and if so, what types of tests. The judgments regarding those issues, in my view, should only be entrusted to a well-trained physician.